All Chicagoans over the age of 16 are now eligible to receive a COVID-19 vaccine. The city officially expanded access today, meeting President Joe Biden's April 19th deadline to open up the vaccination rollout to all American adults. But officials say demand still far outpaces supply, and issues of equitable distribution and hesitancy linger, especially as the Johnson & Johnson vaccine remains on pause here in the U.S. Here to share her insights are Dr. Marina Del Rios, an emergency room physician and Director of Social Emergency Medicine at the University of Illinois Hospital in Chicago. Dr. Del Rios, thanks for being back here with us.
Invitation.
So now that all adults are eligible here in Chicago, the question is, how long are folks going to be waiting or searching or clicking or refreshing their screens to find an appointment?
Well, I think it all is going to depend on how good your internet access is, how tech savvy you are, how much of a language barrier is an issue for you. And what we're going to see is that, once again, we're going to see the little progress that we had made with Protect Chicago Plus, with getting vaccines to communities of color and low-income communities. We're going to lose ground on that as we open up vaccine accessibility to everyone.
So you're saying that the more tech-savvy customers, now that it's open to all adults, will probably jump to the front of the line since they know how to use that. So then how do you make up for that in some of the communities that perhaps don't have that kind of access?
Well, I think that in parallel, we need to be investing in community-based organizations, in our federally qualified health centers, and ensuring that they have the resources that they need to get vaccines to those communities. And that means bridging the technology gap using healthcare workers or promotoras de salud, ensuring that there are sign-up systems that don't depend on people being fluent in English. And basically, short of knocking doors and just telling people sign up for your vaccine, or even bringing it to them if that's possible, which gets complicated with the fact that Johnson & Johnson is now on hold.
Right, and it's almost a race against time here, although Governor Pritzker says this latest surge of cases appears to start to be leveling off. So is Illinois at an inflection point here where perhaps the pace of vaccination can keep up or exceed the pace of this very, very contagious variant, the B.1.1.7 variant?
Well, my worry is that that pace really needs to keep up in all populations, right? So what we're seeing is that these 18 to 49 or so year olds that are now getting infected with COVID because of not because of choice, but because of manners of being exposed unnecessarily. Now will be more protected with the vaccines, but there's still going to be a lot of people that may not have as equal access to the vaccine and are still going to be showing up to work, exposing themselves, and not with the same level of protection. And so what I worry about is that if we don't keep up the pace with the COVID variants, what we may see is a return to some inequities in COVID cases.
So a lot of personal responsibility needs to take place to prevent that from happening. The mayor announced, kind of like the country, 50% of the city of Chicago has received a first dose or somewhere around that. What does that tell you about when the city might be, or the state might be, ready for a full phase 5 reopening?
I would say that I like everyone else, can't wait for everything to go back to normal. But I think we just need to be cautious and wait out a little bit and see how this vaccine rollout to an expanded age group goes. And if we can, in fact, get vaccines to the communities and to the people that we know are at highest risk, it's not going to be very helpful to our population if all that are getting vaccinated are younger people who are healthy, and we're still leaving people that are vulnerable unprotected. So I think that before we move to phase 5, we need to be really cautious and see how well this vaccine distribution goes.
Do you anticipate the Johnson & Johnson vaccine getting approved again? And if so, how could that help efforts in Chicago?
I certainly hope so. The cases that came up that were complications were a very specific age group, right? And so what I foresee is that it may happen, as happens sometimes with medications, that there may be some restrictions, a warning for maybe restricting its use in women in the ages of 18 to 40, for example, and still be safe to use in the elderly and in males. But we'll see. We'll have to see what the FDA decides upon and the CDC moving forward.
And in terms of being fully vaccinated, there's a lot of perhaps confusion out there among people about breakthrough cases, what the actual rate of breakthrough cases are, meaning cases of fully vaccinated individuals still contracting COVID-19. What is the rate based on the data that we have?
My understanding is that the rate is a lot less than 1%. I don't know the exact number, but it's very, very rare. And it's not unexpected. I mean, I think that what people should know is that with every vaccine, protection is not 100%, right? So no vaccine is going to guarantee that you won't get, for example, with the flu vaccine, there's no 100% guarantee that you won't get the flu. Same thing with measles, mumps, rubella, the vaccine against varicella, all of those. The important thing is that it prevents severe illness, which is really the 100% goal that all of these vaccines have and that they seem to achieve, that it's close to 100% protection to severe illness and death. A lot of the cases that have been breakthrough cases have been asymptomatic or minimally symptomatic, which is good. It means that the vaccine is working.
All right, Dr. Marina Del Rios, we thank you for joining us as always.
My pleasure.